Good afternoon. And today we're interviewing a big shot, Dr. Kim Kutsch. Good afternoon, doctor.
Good afternoon, Maria. How are you?
Great. I'm very honored that you agreed to be our guest because I heard so much about you. But first of all, thank you to our audience. Usually my audience stars the people who don't sleep well or sleep next to the snoring partner, but topic of cavities, as both of us being a dentist, is also very important lifetime topic, as well as if you're a medical professional who, just like us, puzzle about where cavities are coming from and how to stop that, disease, and what we can do. We have a guest who devote actually his lifetime career fighting cavities, and he's author of this book what you can see on the screen, Why Me. That's, I always ask, why me? When I see the cavities, I brush, I floss, why do I get the cavities? So he devote the whole book to answer that question, as well as he's a founder and CEO of this wonderful company I use presently for my uh, care, called CariFree. And this is the mints. What we find out what's the secret behind all these products. But I want to introduce my guest to you. So I like that fact, but he was raised on a farm. And he was the first person who got the education through the college, through the dental school. And he had a very active career, not only devoted to his practice, but also to bring the knowledge to practitioners like me, as well as to his patients. He wrote multiple articles and 5 books. He participated in a lot of educational courses. He was the first one who brought laser dentistry to dentistry. And also, now, just like I mentioned, he has this company, CariFree, and the listeners, my audience, can get a very special discount, and I'm going to release the code in the end of the program. Um, but also, he's helping a lot of entrepreneurs to bring products on the market, people who have a very good idea but have a hard time to make it known. So he's helping, and I'm passionate about his latest development, about salivary testing. We devote a lot of programs to salivary testing. I think it's a future of dentistry. So my first question to you, Dr. Kutsch, please tell me, you opened that book with the question, why me? What actually lead you to explore this, very, I cannot call it boring topic, but this very like routine topic with the cavities, instead of just treating it like every other dentist do?
That's a great question, Maria. And I think, you mentioned my background, and I've always in my life tried to find a better way, right? Whatever it was, can we do this better? I always, I don't know why, but it's just how, I put together it. And it's like I always ask them the question, I'm very curious, well, like, why do we do it that way? How could we do it better? And so, about I don't know, 10, 12 years into my career, that's when I first got involved in lasers. I was looking to improve how we do dentistry. And I thought, if we had better technology, if we did things different, we would be better at treating cavities. And yet, I practice in a small town, a town I grew up in. My patients are people I've known my entire life. And they were doing everything I was asking. I was doing everything I was taught, and they just kept getting cavities. And I thought, something's wrong. Like if this worked, it would work, and it's not working. And so I backed up, and I started studying the disease. I realized that I didn't really understand dental caries as a disease, and so I started intensively studying that about 25, 6 years ago, and came to the realization that uh, it's a whole person disease. It's not brush and floss. There's a lot more to that equation than that. And so it really led me down a path. I had some incredible mentors, like worldwide. It was just the birth of the internet, and suddenly I could be in contact with the best minds in the world about dental caries, about cavities. And I came to appreciate what drives and causes this disease. And then I looked at how we treat it, and I found a gap, right? Like Okay, so this disease is primarily based on a biofilm disease. It's based on
Yeah.
pH. It's based on pH. And so I thought, well, how can we modify the pH, modify the biofilm to get people back to health? And so that led me, that's kind of the background of this journey and got me interested in that. And then, of course, I didn't have time to, you run out of time to like explain it to every professional, to every patient, to everybody. And so I wrote a couple of books on the topic. And the most current one is, you see there is Why Me?
This one. Oh,
Yeah.
this one. This
Yeah.
one. This one.
Yeah.
This one.
Yeah. Yeah. So I wrote that book, and it's, guys, the reception has been overwhelming. It's won 3 non-literary awards nationally, and I get a lot of feedback that it's helping people, and so that really makes me feel good.
No, that's a wonderful book. I read it myself, and I think that's a great book explaining in a different concept from the concept I was taught in the dental school. Yes,
Right.
we had a whole, 3 years, I would say, devoted to cavities, so how to treat them, but that was nothing comparing to what you're describing in a book. It's so much deeper in a book. And I'm going to ask you first question. A lot of my listeners might not know what exactly is biofilm disease, like you describe dental caries. And can you explain what changes we should do to prevent and how we have to approach treatment comparing to old concept of drill and fill. What that was a concept in the dental school,
Right.
basically.
Right.
Yeah, we did have prevention. I have to say we have prevention, but conceptually it was very different than you describing.
Right. Well, we were traditionally taught to drill and fill. You see a cavity and you fill it, and that's kind of, you treated the disease. And all you really did was treated the cavity, and you didn't really treat what caused the cavity. And so that's really the whole basis of, this discussion, going back to, let's treat the cause, and then people will stop getting cavities. But first you have to figure out what the cause is. And much like, dental sleep medicine, for every individual, that could be a different answer, slightly. We know there are major trends on that, and risk factors that influence it, but for every person that might be slightly different. And so it's not a one size fits all, plan to help somebody get healthy. It's really focusing on what their risk factors are. It's a biofilm disease from the standpoint of our body. We're microbial planets. It's like,
Haha.
90% of the cells in our body are not human. So we live in cooperation with all of these microbes. In fact, they protect us. They help us digest food. We have microbes in our mouth, and that's that biofilm. It's that layer of microbes, that living layer that's in and on, throughout our bodies, but primarily in the mouth. That biofilm, when it's healthy, it helps our teeth stay healthy. Um, it helps our teeth remineralize after we eat. Those microorganisms start the digestive process for us, so they play a very important role in our mouth. The challenge we get is when the pH gets out of balance in the mouth, for a lot of different risk factors. We can talk about those. But once the pH in the mouth and that biofilm gets out of whack, it becomes more acidic. It selects for a behavior and more of those acid producing microbes, which end up causing dissolution. They dissolve, where they're located. They dissolve a hole in the enamel, and then you have a cavity. So if you can keep the pH healthy and kind of in balance, then you're going to have a healthy mouth, and you're not going to get, as simple as that, you're not going to get cavities.
This is a wonderful explanation, and I have to admit what now I look at the patient mouth differently after reading your book.
Oh, good.
And for example, I had a wonderful friend yesterday in my chair, and yes, he has a rampant decay. But I knew this friend from 4 years old, so I taught him how to brush and floss
Right.
and all of that. And now, unfortunately, he got into that, like I call it a process of self-elimination. I see a lot of the examples of that in the sleep apnea when people grind the teeth or airway collapse. Like I feel like the body cannot protect itself. And caries is kind of a process of self-destruction, self-elimination process for me. That's how I philosophically look at that.
Yeah.
And what I want to talk about for this particular patient, and and myself included too, where I get the cavity, what so different in your product, CariFree product? What ideas you put behind those products to balance our oral environment? What is so different? And I want to talk about fluoride as well in our conversation,
Right.
but fluoride only method, which were taught in the dental school, what this product change on biological level.
Right. Yeah, we're looking at modifying the biofilm. And so some of the early research, Maria, and I mean, surprisingly, this goes back to the 1980s, late 1980s. Dr. Philip Morris at Leeds University in the UK demonstrated that by changing that pH in the biofilm, you drive it to be more cavity causing. And so the question I proposed to Dr. Morris back in 2000 was, so what would happen if we raised the pH? So that what if we got it, more alkaline, and would that select for, a healthier group of microbes and a healthier behavior of that biofilm? And he said, absolutely. And so I went on this quest. I thought, well, that's simple then. I'll just go to the store. I'll buy the toothpaste and mouthwashes and stuff that are most alkaline, and I'm going to treat my patients with them and see what happens. And I've developed a number of companies over the years, and I still had a scientific laboratory that was mine. And so I went and tested the pH on all these products, and I had no clue, but they were like all acidic. And some of them were very, very acidic. And I thought, oh my gosh, this is why these products aren't curing. If they cured the problem, we wouldn't have cavities, right? If it worked, we wouldn't be here. You and I wouldn't be having this conversation. And so I came to the realization that, gosh, I'm going to have to make products for myself. If I want an alkaline product that say has a pH of 9, that's going to drive that biofilm alkalinity back up and create a healthy environment in the mouth, I'm going to have to create those products for myself. And my background, I knew how to build companies. I knew how to interface with the FDA, how to, interface with the patent office, and, go through all of those steps in building a company and manufacturing products. So I had that knowledge base, and I thought, well, I really wasn't looking at the time to build another company, but I realized I got to do this because it's not out there. And then I discovered why there weren't any alkaline products on the market.
Why?
It's all about shelf life stability. Like when you have a product that has a pH of 4.5, which is pretty acidic, nothing wants to grow in it. When you have a product that's a pH of 8 or 9, everything wants to grow in it. So trying to create a safe, stable shelf life product took us 4 years to work out. And that's something that we sorted out. Took a team of engineers, like literally, it took us 4 years to sort that out. But once we did, then we were able to create an entire product family, products that help drive the pH up and protect that pH. We have data from independent laboratory testing that using our 5000 Pro gel, for example, will raise the pH in the biofilm, and then after 20 minutes of continuous sugar exposure, that pH of the biofilm is still
Above.
it's still above neutral. So it's still in a very in a very safe zone. So we know that those products work that way. So that's the basis.
That's
Basis
a
behind it.
beautiful thing. But I'm going to ask you a tricky question. I have a lot of patients because I treat sleep
Yeah.
with the acid reflux.
Yeah.
And yes, that's make pH very low. But I'm surprised they have acid reflux defects. Some of them lingually, on the tongue side, some of them on the cheek side, but that's not decay.
Yeah.
Why
And
is that?
why is that? I think what you get from that reflux is an exposure of a very extreme low pH. And so it does more erosion than modifying the biofilm. So it really is faster at eroding the tooth and dissolving it than it is at changing the behavior of the biofilm. Yeah, that's a very interesting question, Maria, because you see that, but you don't typically see cavities in those people. Or if you have like the bulimic patient, a lot of regurgitation, and you see all that erosion of the tooth structure, but you typically don't see any cavities. They really don't have it's happened so fast that it hasn't really modified the biofilm.
That's it. It's like was bothering me, that question I really want to ask. But I want to ask you also towards my sleep apnea population, because most of my audience
Oh,
have
yeah.
some type of relationship with sleep. And a
Yeah.
lot of my sleep apnea population have also allergies. They don't breathe well with the nose. Usually they have seasonal allergy. We explain, sleep problem in one way. But after reading your book, I come to realization what they use a lot of allergy suppressing medications. And those medications come to another factor, what you describe so well in your book about lack of saliva, dry mouth. They
Yep.
can say dry mouth, we explain, okay, you're breathing through your mouth, but you also have some medication which suppress the saliva flow. So tell me, what's the correct regimen for people who either take allergy, fighting
Right.
medications, or even for all the population of my patients who take a lot of medications in general, and those medications also make the mouth dry?
Yeah. You bring up a really good point, and this is the biggest risk factor for tooth decay today. 70% of all Americans across all age demographics take at least one prescription medication per day. Uh, 20%, take, 5 or more. And the number one side effect of all these medications is dry mouth. And you reduce that saliva, which is, that saliva protects the teeth and it protects the biofilm. And you reduce that, and then suddenly it puts you at risk for getting cavities. And if you eat a lot more sugar, or eat, an American-based amount of sugar, which is about 23 teaspoons per day, which is a huge amount, and you don't have enough protective saliva, now you've got a real issue. And if you snack frequently during the day, as many Americans do, your mouth never really has an opportunity for that pH to recover. And so you're really putting yourself at really high risk for getting cavities. So I think the most important thing for those patients, you can't take them off their medications. Yep. The most important thing for those patients is to use oral health care products that are helping protect the teeth as well, driving that pH up. And then we also make a spray which has a pH of 9 that I recommend for those patients. Like when you start to feel your mouth is a little dry, you can drink water. We need to talk about that quickly. But or you can use a couple of shots of a spray that has an elevated pH that will help recover and rebound that pH in the mouth. The one thing about drinking water, and I didn't know this until a number of years ago, a lot of our patients don't drink tap water anymore. They're, I don't know what the number is on how many bottles of, bottled water that we consume in America, but it's astronomical. But a lot of bottled water has a pH of 4 or 4.5. So when I tell patients I want you to drink water and keep your mouth, stay hydrated, it's really important to know what the pH of the water is you're drinking, because if you're drinking water that's a pH of 4, you're not helping the situation. We need to get that pH back up. So tap water tends to be typically around 7 to 7.3, somewhere in that neighborhood. And there are some bottled waters that are like alkaline or neutral. Again, it's a shelf life issue for those waters. You take everything out of that water and, all the minerals and things out, it's like a shelf life issue in terms of, well, how are you going to stabilize that so nothing grows in it? And the easiest way to do that is acidify it. And so that's why so many of the bottled waters are acidified. It's just strictly a shelf life issue. So patients need to be aware of that. So when we talk to them about staying hydrated, it's not just drinking water, it's knowing what the pH of the water is that you're drinking as well.
I would say that's fascinating stuff, what nobody ever brought to my channel before. So that's the big thing. But I'm going to ask you, you mentioned two things, what important to me. Let's start with sugar. Some people cannot live without sugar, just cannot live without sugar. It's not a life. So you talk in your book about xylitol. I use that product when I ask my patients to rinse the nose because it has antibacterial property. What is it that component or sweetener, and how can people sweeten the life without affecting the pH?
Yeah, I mean, so there's a number of things like xylitol, sorbitol, maltitol, stevia. You've got some other, things in the market that aren't sugar, aren't sucrose or fructose. Those are sugars that um, immediately the biofilm in the mouth starts to digest them and produces acid. So you get that acid production right on the teeth. Xylitol tends not to do that. In fact, it makes it harder for the bacteria to actually produce acid, and it's sweet. So you can cook with xylitol. You can use it. We use it in products. Actually have a very high level of xylitol in the products. A lot of them are 28 to 40% xylitol, and it has some anti-cavity effects in terms of reducing the activity of the biofilm, particularly microbes that tend to cause cavities. So it's a very beneficial ingredient, and it's also sweet, and it doesn't also tend to challenge people that are diabetic or pre-diabetic, with their blood sugar levels. So that's something that we use. We've been using from the beginning. It's an ingredient that helps sweeten your life without increasing your risk for getting cavities. I like
That's
the way.
a beautiful answer. I want to ask you, last question about dentistry. What is actually Stephan Curve? My friend, Dr. Jessica Lindenhausen, devoted the whole book about snacking, her book Oral. But you talk a lot about snacking as well here. And yes, American culture, we like that. And even not American culture, I was born in Russia, but if I have active thinking process, I want to have something in my mouth. Can you explain why snaking is bad, how it's changing pH, and how people who so used to that uh, can do to prevent the decay?
Um, so so I think the important thing here is making sure that your mouth is hydrated. Making sure that you have giving your mouth time to recover. Every time you eat or drink something, um, primarily the pH in your mouth drops. That's part of that Stephan curve that we learned in school. And your mouth needs like 30 minutes or so in a healthy mouth to be able to recover. So you don't want to continually sip on something. You don't want to continually snack on something. You want to limit your sugar intake. And if you're going to eat something that's sugary, and we all do, uh, consume it at a meal and consume it at one time. So you have one episode, and you give your mouth an opportunity to recover rather than like say eating, nibbling on a sugary snack like all for like 3 or 4 hours during the day, or sitting at your desk working and having a cup of coffee that has either sugar or a sweetened creamer in it that you sip for hours on end because you're not giving your mouth a healthy opportunity to recover. So, and then again, brushing and flossing are still important. Oral hygiene, good oral hygiene. Taking care of your teeth, removing that plaque level every day. You know, I tend to think of plaque removal rather than brushing and flossing. I like to discuss it that way. Um, and so that gives you the best opportunity to stay healthy. And I think just being aware of what causes cavities in the first place, and then looking at your own lifestyle. Well, where are your risk factors, and how can you kind of improve that or mitigate those risks so that you reduce your risk for getting cavities? And it works. I mean, I've done that with patients for 20, 25 years, and I have so many patients that became decay free. And my dream is a decay free world.
That's a beautiful thing. But now, controversial question. What your relationship with fluoride? You put totally different hydroxyapatite in your products, but
Yeah.
as a dentist, like right now, we all live in that world. But fluoride become a very controversial question. I wrote the articles for Forbes about that, and now
Yeah.
state of Florida remove fluoride from water. What's your relationship with
Oh man,
fluoride?
I have a complicated relationship with fluoride, Maria. Um, and I'm teaching actually a webinar on June 10th on the future of fluoride. And I understand both sides of the argument, right? Um, when the primary benefit from fluoride, and the benefits are well established, it
No
helps
doubt.
it helps in terms of it's an anti-cavity fighting agent, and it makes enamel stronger and more resistant to decay, and it reduces the amount of decay when it's in our drinking water by about 30% in children's teeth. I mean, the results, the data is, it's clear. The benefits are well established. Uh, uh, and we also know the primary benefit of fluoride is topical on the teeth. We used to think that drinking the water was the benefit was taking it internally and it gets incorporated into the enamel as it's developing. And yeah, a little bit of that happens, but primarily we know now the benefit is just the topical effect of the fluoride on the teeth. So in drinking water, you get the topical benefit, but it comes with some systemic risk. And there's a lot of data, conflicting data around what those risks are. Um, so taking the fluoride out of the water, I'm hearing a lot of background noise. Are you?
It's
No?
it's outside.
Oh, okay.
We apologize for that. I cannot
Okay.
change
All
it.
right. Okay. I just want to make sure it wasn't me. So by taking fluoride out of the water, it's readily available in a lot of fluoride products, right? So people that want fluoride can get it. I understand the argument of being forced to take like a medication or something, particularly after we all went through the COVID vaccine episode. So I understand that. I'm sensitive to that. So I look at this whole issue from the benefit to the risk. And then I recently, and I've been teaching this year because it's been such a hot topic to a lot of dental professionals. And I've come to the conclusion that my opinion isn't important. What's important is me being able to meet the patient where they're at and being able to address their desires. If they're comfortable with fluoride, I've got great products available to us that have fluoride in them, and the benefits are well established, and we believe they're safe at the levels we use them at. Um, if they're opposed to fluoride, I have alternatives to fluoride, particularly like with nanohydroxyapatite in our products, which help strengthen the enamel and remineralize it as well. So my relationship with fluoride has really come to a point of I don't I can see all sides of the issue. I want to respect the patient's desires and opinions. So wherever you're at, I want to meet you there and I want to be able to help you.
That's wonderful. Last question. You
Yep.
help a lot of entrepreneurs to establish product lines in the companies. And, we're talking about latest one, the salivary test was going to save a lot of
Yeah.
lives, I think.
Yeah.
But what valuable advice you can give to people who come up with great inventions and want to make it a reality? And it's a very rough pathway, but you walk the pathway many times and you lead the people by hand many times.
Yeah, that's a really, really great question, Maria. And of all the things that I do, that's one of the things that I enjoy the most is being able to help young entrepreneurs take some of the hard life lessons that I learned building companies to help them on their journey and hopefully help them prevent making some of the mistakes that I made. Um, and so I think the most important question or most important advice I could give them is find some mentors. I have a young entrepreneur that I'm actually working with right at the moment, and he has a quote, and I love this quote. He says, Success leaves clues. And so the meaning of that is you look at somebody who's successful and you can see what they did to get there. So instead of trying to recreate the wheel and figure it out on your own, ask somebody that's already done it and just ask them, can you help me? I have questions about this and I'm not sure what to do next. And being able to get their advice, you'll find that so many of these people that have been successful have done that, are so open with their ideas and ability to share and help others out. I mean, it's I don't know, it's one of the greatest gifts I've been given in my life. I have incredible mentors that I'm so thankful for. And so for me, it's being able to mentor down and help young entrepreneurs because I've been through what they're going through, and if I can give them advice, um, that's very rewarding for me. So my best advice to them is success leaves clues. Find
Oh,
find great mentors.
thank
Yeah,
you very much. And for my audience, you can get the discount for CariFree products. Get the book on Amazon. Um, and get the products to fight the cavities in any age. And you can use the code. We're going to put it underneath the interview, Maria 10, and you get 10% on the products. And also you can find absolutely amazing Dr. Kim Kutsch through the Instagram and the TikTok. He's on every social media, and you can listen to his podcast. That's another very interesting thing what he is doing, and read the book. So
great.
thank you very much, doctor.
Oh,
And I
thank you.
hope people use the benefit of your knowledge and your to fight cavities, and knowledge to find the clues to be successful. Thank you.
Thank you so much, Maria. I very